Here's a simple test that I use to evaluate and teach breathing mechanics. So I'm just gonna lay down and I'm gonna place one hand on my belly button, kind of my ring finger maybe on my belly button, pinky, and then one hand on my sternum. And I'm gonna take a couple deep breaths. So I'll just take one breath. Usually I tell my patients to take 3 to 5. And what I'm looking for to represent good breathing mechanics is 3 things. First, we're breathing through the nose by default rather than the mouth. We want to be nasal breathing most of the time. Second, is that my bottom hand, I want that hand to move first. So when I take a breath, I want to see this bottom hand rise before my top hand. And the third thing, this is more of a feel, is can the abdomen and ribs on the side of my arm, do they not just move up, but do they move outwards a little bit? Do I fill some of this space with my torso? So those are the 3 things I look for that represent pretty good breathing mechanics, but they can be taught very simple in just a minute or so. So why I look for these things is first, nasal breathing has a whole lot of benefits compared to mouth breathing. There's been books written about it. The one I'll go with today is that when you breathe with your nose, it better engages the diaphragm. So this links all of these points together. When we breathe with the diaphragm, ideally we're using the diaphragm's a muscle under the rib cage here that the diaphragm is going to engage, and the belly is going to come out and the ribs are going to tilt a little bit. So we'll see the abdomen moving first. We'll see the belly button moving. When you're laying down, it's going to be moving up or in this position towards the camera. And we're going to see the ribs tilting out a little bit. So it's filling some of this space on the inside of my arm. If I had 2 hands here, I would see my hands moving apart a little bit as well as moving towards the camera. And the third reason we want to really be using the nose and we want this bottom hand moving first is that the upper chest, what this top hand is doing, is we're looking here at the use of what's called accessory breathing muscles. So these are the muscles of your upper chest and of your neck. So it's the scalenes, the levator scapulae, the pecs, some of those muscles. And so a lot of people complain of some chronic neck stiffness, tightness, pain, lack of mobility kind of in their neck and shoulders, or they say I carry my stress in my shoulders. And if this is you, it might be, it could be a lot of different reasons, but one of them that's worth assessing is, are you using these accessory breathing muscles as your primary respiratory drive? Meaning, are you breathing up in your neck, in your chin, and your shoulders rather than down in your diaphragm? We have these muscles to expand the lungs just a little bit more when we're at the top end of our cardiovascular ability. So when we're really out of breath, we're really going for it, that's when I'm going to start breathing more with my mouth. I get more volume and I get faster, and I'm going to be using more of my chest to breathe. But outside of a maximal exercise, when you're doing maximal exercise, outside of that, we generally want to be breathing through the nose and breathing diaphragm first, and that can allow the chest muscles to relax. And if you have some of that tightness and this is a cause, it can start to make you feel better. So there's a whole lot of benefits to breathing in this way with a more anatomically correct diaphragmatic nasal breath. That's just a couple of them, but use this simple test and you can kind of assess, is bottom hand moving first? Am I moving or using my nose? And then am I getting some motion upwards and outwards through that abdomen?